Plus, new details in a deadly shooting at a house party in Sunnyvale. What we're learning about the victim killed.
And pediatric cases in the U.S. are soaring just as school starts back up. Good evening, I'm Alan Martin.
And I'm Elizabeth Cook. Joining us live now, MarinHealth Chief Medical Officer, Dr. Karin Shavelson. Doctor, thank you so much for joining us this evening.
My pleasure, thank you.
Nearly 1 in 5 cases in the last week of July were children. How worried should Bay Area parents be? Is it that they're simply more at risk because they aren't vaccinated? Or is the Delta variant just that more aggressive in children?
Well, the good news for Bay Area parents is the Bay Area in general has done a wonderful job of vaccinating as well as masking. So we can take some comfort in this. We aren't quite sure yet if this virus, if the Delta variant in particular, is more aggressive in pediatric patients or if it is, as you mentioned, because our 11-year-old and under children in this country are not yet eligible to be vaccinated. It is of sufficient concern that a couple days ago, the American Academy of Pediatrics came out with a statement encouraging the FDA to speed up the EUA process for pediatric patients. As a pediatrician myself, I hope that the FDA will take this recommendation and this request under guidance and strongly consider speeding up the vaccine timeline for children ages 11 down to 5.
Yeah, a lot of anxious parents hoping to get their children protected. What about play dates, camps, and other after-school activities? If all the adults in the family are vaccinated, and you know that the other family is also vaccinated, all the adults, at least those who are eligible, does that provide an adequate level of protection, or should parents be scaling back on those activities right now?
You know, like so much during this pandemic, there's no perfect one-size-fits-all answer, and I know that's frustrating for everybody, myself included. Some of it is your own comfort level. Some of it is the behavior of the other adults in the group with which you participate. It's absolutely imperative if children are going to be having play dates and bringing in outside adults or children that they don't normally spend time with. Masking is going to be really important. I think you can take some comfort in the safety of masks. We know they work. We know that they improve the safety for everybody involved. And so I think as long as there's good masking, good hand washing, and then one of the imperatives is if you don't feel good, if your child doesn't feel good, quarantine and get tested, even if you've been vaccinated. The good thing is the vaccines prevent death and serious illness, but we know that the vaccines don't entirely prevent getting COVID. So absolutely, if you don't feel good, stay home, get tested.
We're also hearing about this new coronavirus mutation known as the Lambda variant. How is this different than the Delta variant? Should we be more concerned about Lambda?
Right now, the CDC doesn't seem overly concerned about Lambda. We know it's been a bit of a problem in Peru, but they're using a different vaccine than we are. There is some concern that it's a little bit more resistant to vaccines. We haven't seen this to be the case in the United States. There are some reported cases in the US, and it hasn't spread like Delta has. So if I were going to ask your viewers to focus on a particular variant, I would say right now it's all Delta. Delta is that heat-seeking missile that is just going to find you if you're unvaccinated. So if you want to worry about a variant, let's focus on Delta for today, and we'll see what tomorrow brings.
I want to ask you about the summer colds also that have been going around. Of course, a lot of parents, every single time their kid sniffles or sneezes or has a cough these days, you automatically think, what if it's COVID? So you go in and get a test. But there's also the summer colds that have been circulating around. Is there a chance that some of those summer colds could provide some level of protection against COVID for that period of time? I know there's been some study on that. I want to know your thoughts.
Right now, we're not seeing that those colds are providing any immunity against COVID that we think is sufficient for people to not worry. We absolutely are seeing a big spike in viruses other than COVID, such as influenza, RSV, and rhinovirus. We usually see these every winter, and they're a lot worse than the public realizes. They cause significant morbidity and mortality, nothing like COVID, but not inconsequential, particularly in the pediatric population. What's happened is we had almost none of those infections this last winter. There were almost 0 pediatric influenza infections or deaths in Marin County and in the Bay Area, which is unheard of. But then we opened up and we took off our masks and we started getting together again, and those viruses have picked up and taken off. Unfortunately, right now, without testing, there's no way to tell based on your symptoms if you have COVID or if you have influenza. So unfortunately, got to get tested.
Yeah, it's very frustrating for a lot of parents. One last question. I want to ask you about herd immunity. Given the rate of vaccination and given how quickly this Delta variant is spreading, is there a chance that we could actually reach herd immunity based on the number of people who are vaccinated and the number of people who have contracted COVID through this Delta variant?
I think it's hard to say for sure. I think we're all quite concerned about that. We believe herd immunity is at least 90% right now. Again, this is uncharted territories. We have not been in this area before. So we're not entirely positive. I would absolutely counsel your viewers not to say, oh, because I've had COVID or because I'm going to get COVID, I have immunity and that's going to count towards herd immunity. We know that you get a much better immune response to the vaccine. So I urge you, please get vaccinated. It's the best thing you can do for yourself and for your community. And if you do it for no other reason, as a pediatrician, I'm begging you, do it for the children who are 11 and under because they can't be vaccinated. We adults, we older teens, we need to get vaccinated for them.
That seems to be the key, vaccination and masking. One last question. Any last pieces of advice for parents who are sending their kids back to school, some for the very first time, in the coming weeks on how to protect them and of course, the rest of the family?
Yeah, absolutely. It's the things we've talked about and we've all gotten, unfortunately, quite good at doing in the last year and change. Masking, washing your hands, socially distancing, staying home if you don't feel good. This works. We don't like it because it's not much fun, and I'm as sick of wearing masks as all of you are. Healthcare workers, we've been wearing masks a lot lately. We would love to not have to wear masks 24/7 when we're at work. But it works. And so that's the best thing that we can do as a community. And it's the best thing we can do to keep the kids safe in school. I know it's a really stressful time, but I think that it's really important for the development of our kids to be back in school. And so that's why I just really want to encourage any adult who's not vaccinated. We want kids to be in school in person. We want them to have a normal childhood. Please get your vaccine.
All right, doctor, thank you so much for joining us. Great tips there.